Okay, it is 6:33. It looks like the number of attendees has topped off. So I want to first begin thanking everybody for giving us some time tonight and being open and willing to talk to us and give us feedback on the plan we're presenting and the plan we presented earlier about phasing in, bringing students back into the building here at Creative Minds. I want to run over a couple sort of ground rules real quick so we can make sure everybody's questions get asked and answered and this runs smoothly. So first thing I'm going to ask you all to do is put your questions in the chat. You can put them into the chat at any time. When you put them into the chat, click on to panelists and attendees. That way everybody else on the call will see it, not just the folks from the school. So that might reduce some of the duplicative questions, or you can say, yes, I agree with so-and-so. I want you to answer that question, please. Just make it a little more efficient for us all. We are going to hit record in a couple minutes for those folks who are unable to join us today, and we'll make it available. Also, it's helpful for us to go back and make sure we answered all the questions that were asked. And then I'm going to ask Craig to play a role of game show host, and he's going to monitor the questions. And after we go through a short slide deck, he will direct the questions to the appropriate staff members to try to give you answers and try to facilitate our dialogue. All right. So with that, can I get someone to click record, please? Oh, someone did click record. Thank you, Stephanie. All right. Well, I want to thank everybody. Again, what I'm going to do is I'm going to share my screen. I'm going to jump right into the deck. As I mentioned, it's a fairly short deck, but I hope it'll answer some of the questions and give us some give you some good information so we can have a productive dialogue tonight. So give me a second while I share my screen here. All right. Has everybody seen a big picture of our school and something that says reopening at Creative Minds International Public Charter School? Anybody give me a thumbs up? All right, awesome. Thank you guys. All right. This deck is pretty jam-packed with information. So I don't normally do this when I present a deck, but I'm gonna almost read it word for word. So I make sure everybody hears, because I know some folks are on their phones. And again, it will be available for people to look at later. And as we're going along, some of the staff are also going to be dropping in the chat links to some of the things we're referring to, whether it's our safety plan or things like that. So this is sort of an amalgamation of a lot of information, but we want to get it out to you guys as soon as we could. All right, so again, thank you. So for those of you that have been on these calls before or have joined the board meetings in the fall when we dove very deep into our decision-making process, we made it very clear that there are 6 critical non-negotiables that guide all of our decisions about reopening. And I'm just going to remind everybody what those are, and you'll see how they are folded throughout the presentation tonight. The first one, and obviously the most important one, is health and safety. Making sure our community's healthy, making sure they're safe. As folks like to joke, Chuck always says, you can't teach sick kids and sick teachers can't teach healthy kids. So we got to keep everybody healthy. Second one is transparency. Again, we've only presented information when we have answers and when there's facts. I've tried to share as much as we can share about the data. I know everybody's getting information from all different fronts. So part of this exercise is an exercise in transparency. The third is we are going to meet the needs of our students. That means that's what we're focused on. We're in education for our students and to build wonderful, beautiful human beings. We're not here for the politicians. We're not here for the economy. We're here for the needs of our students. And so that necessitates a deep and hard look at what our students' needs are in this pandemic. Number 4, early childhood, unlike many schools, when they did try to reopen in the fall, sometimes successfully, sometimes not, most brought back early childhood as an automatic priority. At CMI, at Creative Minds, it has not been a need to make it an automatic priority. Our early childhood virtual programming is one of the best in the city, we've been told. And we've actually been training other schools on how to be somewhat engaging as much as possible for our early childhood programs. Number 5, we're going to start small. What I mean by that is 50 students or fewer. We picked the number 50, having a rough idea of how many staff were willing to come back into the building, what was a manageable number of bodies to move around, and where we felt it was very likely we had a number of kids who need some additional support. And we'll talk about those kids in a few minutes. And then last, data and science. As I have mentioned many times, this is not about political pressure. This is about really meeting the needs of our kids. We're making this decision and sharing it tonight because we've identified a group of kids who the virtual platform is simply not working. And we've got to get them in, whether it's due to home conditions, internet access, food insecurity, special needs, language needs, whatever it might be. We've done a deep data dive, looked at the science, looked at the data, and decided these are the kids who need to come back sooner rather than later. And that will allow us to understand how to bring back more kids. So right now, just to talk a little bit about where things stand in the city and where we stand. We are living and breathing the metrics provided by DC, Department of Health, the CDC, the mayor's meetings, all the deputy mayor for education meetings we're a part of, the Office of the State Superintendent meetings, we're talking to them weekly, even more than weekly. So we are, the newer developments that I want to talk briefly about tonight are these variants that are coming out. That's got a lot of people worried. And today around 4 o'clock this afternoon, Dr. Nesbitt mentioned or announced in a news conference, and she is the head of the Department of Health here in DC, that there are 4 cases of new variants here in DC. 3 are the UK variant and 1 is a South African variant. She did, however, say in a moment of great transparency that this is based on a very small sample of the positive tests here in DC. There's been 38,500 positive tests in DC. They only can do a sample where they do the genetic testing to figure out if it's one of the variants. So positive is positive no matter what the variant is. So out of that small sample, 4 of them came back. So she acknowledged that it is underreporting significantly. Just to give some more context around it, Virginia has reported 6 cases. Again, they are doing random sampling as well. 5 are UK variant, 1 is South Africa. Maryland has reported 23 cases. 17 are the UK variant, 6 are the South African variant. And currently, and the thinking changes almost on a daily basis, the concern is the UK variant is the much more transmittable one than the other variants, whether it's the Brazilian variant or the South African variant. And that's the one that's got people very concerned, which is why you're hearing things about double masking and extra precautions that folks are encouraging people to do. So knowing that, tracking these variances, we as a school, and I think we as a community need to be ready to change course if we have to. We've always talked about this through every time we've talked about making a decision that there is a possibility, given the health metrics and what's going on in the community, that if the risk increases, we may have to go back to all virtual. I just want to put that out in pure transparency and honesty. COVID-19 testing. We do not require negative tests for our staff or our students to come back in. Violates all sorts of federal laws to ask people for those tests. What we are offering, which not a lot of schools are doing, but we're doing it, is we're offering an on-site testing program for staff. And we will expand it to our in-person students and their families, or anybody else in our community who wants to come in. It's super efficient. We're partnering with Elaine Ellis Health Clinic, which is a Ward 7 based health clinic. They are amazing. I've gone through it 3 times. You're in and out in 10 minutes of the testing tops. You might have to wait to get tested, but it's not a very long wait at all. We've done 40 tests each time in under an hour. So it's a great thing. We're strongly encouraging all of our staff to do it. We're strongly encouraging anybody who wants to come back into the building to do it. Knowledge is power. Right now, we're also monitoring the metrics around the vaccinations. So some of our staff have already received their first dose. Some of us are lined up to get our second dose next week. Additional staff have expressed interest. Their names will be submitted to DC Health once we get a solid list of everybody who's willing to come back into the building. We're not requiring staff to be vaccinated before they come back to work. We're not requiring vaccinated staff to work in the school building either. So if you do get your vaccinations, we're not saying you have to come back. Again, families might have different circumstances. where they're in a higher risk environment at home. They may be caring for elderly, immunocompromised, whatever the case may be. What we're doing is putting people in charge of their own level of risk and trying to do everything we can to mitigate that risk. Right now, the only people in charter schools who can get vaccinated are the ones providing in-person services to students, or who will be very soon. So that's why the list is kind of small. It's not all teachers. There aren't enough doses for all teachers. In fact, all the doses that were offered DCPS, over 1,000, weren't even used because teachers didn't want to go in and get vaccinated. Those were released and given to the charter network as well. But we have had a good number of of staff say they want to get vaccinated, they want to come back. And so we are doing everything we can to lobby to make sure they get on the list of eligible people. So this is probably what we're all really excited about hearing about. When are we going to bring kids back, and what's it going to look like? So I need to start with, returning to school is not required for any student or staff member. We are inviting people to come back. We are trying to create circumstances where it's as safe as possible. But again, as I mentioned, everybody's risk levels are different and people have to make their own decision. Remote learning and remote teaching and remote work are going to remain options so long as this pandemic's in place. So I imagine that'll be at least through the rest of the school year. We will have the option for families to stay in remote learning, for teachers to continue working remotely, and for other operational staff and admin support to work remotely. But in order to phase it in and build confidence and reduce the anxiety, on February 16th, we're inviting staff to come back. We're inviting them to return to campus, people who want to work in the building, whether they're going to teach virtually from their classrooms, whether they're going to provide direct support to students come March and April. And we're going to train them for those 2 weeks in February on the safety practices and protocols. So when we do bring students back in March, our staff has it down. They know exactly what to do in every circumstance. They've been through the protocols. They know how to do the screenings. They know what to do if someone displays symptoms, all of that good stuff. And we'll run them through the protocols so we know that they're safe. March 1st, what we're calling creative care begins. Those will be the remote classes, so the virtual learning, but there'll be students in the school building. This is what I alluded to a little bit earlier, excuse me. We did a deep data dive back in the fall and identified almost 70 students who were struggling virtually. Then we went through that list again and winnowed it down to ones that were struggling a lot, ones that were struggling, but we could make accommodations, and other ones where we could make other smaller accommodations. So that small list at the end of the semester actually blossomed into a much bigger list of about 50 students. So we've reached out to those families and those students last week and this week and invited them to come back. What's going to happen if they accept is there's going to be in-person support from teaching staff. It's going to be academic support, socio-emotional support, and technology support. They'll be fed in their classrooms, they'll have recess, they'll have some social-emotional support. We're going to try to make sure they can log on. And we can talk a little bit later about how we identified those students, but in general, we looked at assessment data, we looked at attendance data, we interviewed our teachers multiple times and our directors to ask them what students were struggling, which ones weren't showing up, and what the struggles were. In April, and this is a target date, April 1st is a target date. It might be a little bit earlier, it might be a little bit later. I'm hoping and I'm going to push for that Monday before April 1st, but again, it'll depend on who comes back. It'll depend on how the protocols are working and how many students we have. But in April, we're going to bring more students back into the building. At least that's what we're planning to do. We'll have schedules, we'll have a start date, modes of learning, number of students. All that's going to depend on how many staff are willing to come back and teach in person. It's also going to depend on the public health situation. And it's going to depend on the number of you families who are interested in coming back. We'll take all those factors and we'll build a schedule out of it. So let's talk a little bit about what creative care is, what that is beginning in March 1st, and then we'll go into the other modes after that. So what is it? Students are going to receive direct academic and emotional support, socio-emotional support from teaching staff. They're going to be doing the same virtual lessons with their classmates, so they'll still have that time. They'll be with their same teachers that they were with before, but they're going to have a teacher or teaching aide or dedicated aides with them in the classroom to help them stay on task, help them log in, help them stay logged in, help them do the homework, sound out the words, whatever support and scaffolding they need, they're going to have real live help. We're not going to have any more than 10 students in a class. That's following the CDC guidelines that will allow for 2 adults in each class of 10 students. It's likely to be less than 10, but we're capping it at 10 as we build the class schedules. So how's it going to work? And again, we can answer some detailed questions if you'd like down the road, but we did cover this a lot back in November. Students were chosen on the basis of their academic and socio-emotional need. We identified the families and contacted them last week and early this week, and we're compiling that list right now of folks who definitely want to come back on March 1st. Students will not bring their Creative Mind issued tablets or laptops to school. We're going to have those here. So we're not bringing outside contaminants in that we don't have to wash every time they come in. We'll have clean, sanitized tablets and school materials available in person for them when they come here. Staff training and safety protocols will begin on February 16th. Again, that's why I mentioned we invited staff to come back on the 16th. So expanding in-person learning. Again, the target start date is April 1st. At this point, we can give you a general overview of what that's going to look like. The main goal is to increase the number of students brought back into the building safely, to get more students in that socio-emotional healthy space, make sure more students are getting the supports that are available with in-person teaching. And as we all know, it's a very different experience, even if you're doing virtual lessons, if you're doing it with a trained adult in a classroom and with your fellow students. But, and these are pretty big buts, the number of students will be based on staff availability in the public health situation. So what we're going to do in the week of March 1st is we're going to send an email with more details of what this program is going to look like. We'll be able to report out briefly on what the first week was looking like, and we'll send out a family survey to see what the interest level is for people. Just as a reminder, back in the fall, we only had about 30% of our families who said they were willing to come back. In the fall, the rates were lower. In the fall, the number of deaths were lower. The daily average rate was lower. So I don't know if that means it's going to be a lower interest rate or higher because folks just want to get their kids into a school. So that's why we're going to run another survey to get real numbers. And in that survey, we're going to ask people to choose. And when we ask you to choose, what we're likely to do is we're going to ask you, if you pick virtual, you're going to stay virtual. If you pick in person, if we can accommodate you, and we'll talk about this in a couple of minutes, you can always drop back into virtual. If you get back into school and you're just not comfortable, or your child tells you about someone sneezing, I don't know, whatever people's comfort triggers are, you can always go back to virtual. That will continue to be an option. Expanding the in-person learning. Again, the target start date is April 1st. What might this look like? We're looking right now, the current thinking is in order to get as many staff and as many students back in and approaching some semblance of normal, looking at a cohort, a staggered cohort system. Cohort A, probably learning Monday and Tuesday, a cohort B, learning Thursday and Friday. Again, there's no school in person on Wednesdays. That's the deep clean day for the building. It's also professional development day for staff. Gives us a chance to look at how it's going, make adjustments, and make sure we're providing good service. So again, all that will be explained when we present options. The format is going to depend on the level of family interest, staff availability, public health. We will offer sibling priorities. So if there are children in different grade levels, we're going to do our best. There are no guarantees, obviously, because it's the first time any of us have ever done this. We are going to do our utmost to keep the siblings together so it's not too difficult for families. So if one sibling's AA, hopefully all the other ones will also be AA. And we'll work to accommodate families to what your requests are as much as possible. So big picture, stepping back, what do these 4 ideas look like? So currently for the remainder of the year, all the classes, the creative care, expanded learning, and the remote are going to be on the same pace and the same curriculum for the all modes of learning. What that means is we're not going to run 2 different schools at one time. We're not going to have 2 different academic programs at one time. We're going to have the same academic program, but with in-person enhancements to folks who opt for that and folks we can accommodate. And again, Wednesdays will always be, at least for the remainder of the school year, remote instruction for all students. March 1st, quick reminder, remote learning at school, up to 10 students in a class, probably less. Same learning that the kids are doing at home is going to happen in school. Teaching staff will be supporting the students. Health conditions, however, and we're going to have to qualify this. I don't want to sound like a broken record, but it's critical that we're honest. Health conditions may necessitate that some or all students have to return to remote learning. For example, San Diego schools just reopened, and 2 days after they reopened, they had to quarantine 100 students. So it wasn't because it was spread at the school, but it was because it came from the outside into the school. They did testing in the school. They identified 7 people. Those 7 people contacted 100 other people. So they suddenly had to shut down school for 100 people. So those kind of things happen. And we're just being honest that that could happen. April target date, expanded in-person learning. Again, the very small class size. Again, the same schedule. The start date, again, will depend on sort of how far along we are in our protocols and when staff come back into the building and when families say they're ready to come back. The modes of learning are going to be the same. The total number of students will be based on available staff, public health, and interested families. Same qualifier here. Remote learning will be available throughout. That will go until the end of the school year. And the thing about remote learning is the one thing that won't change. It will stay constant. The schedule will be constant. The scope and sequence will stay the constant. Doesn't matter if there's a breakout at the school or if there's one in public, that will remain constant and hopefully provide some stability. Logistics and safety. So here's just a high level, again, for those who are interested, we've got very detailed plans. We've got detailed decks of all the protocols people run through. But so you'll get a sense of what we're going to train our teachers on when they come back. There's going to be a daily screener. It's going to be required for all visitors to campus, including students, staffs, and families. There's going to be visits are going to be recorded. So everybody's got to check in. So that way we know who's in the building when, because if there is an outbreak or someone displays some symptoms, we know how to inform the tracing and tracking program. And PPE is required for everyone 2 years and older. We have plenty of it, so we can provide it. If a student forgets it or a staff member forgets it or something breaks, we will have plenty on hand. So there's no reason people can't cover up and keep safe. Learning at school. Some of this, these are all straight out of the CDC requirements. Social distancing will be enforced. Classrooms are going to be set up to keep kids apart, 6 feet apart. Meals will happen in the classroom. Moving throughout the building is going to be very controlled, and it's going to be in cohorts. A lot of times when you've come to visit the school, you'll see we let kids go to the bathroom when they got to go and all that kind of stuff. We're going to be a lot more controlled, again, to contain the contact, to make sure our cohorts and there's not cross-contamination. There are restrictions. The restrictions are going to be minimizing contact among other cohorts. So the same group of kids will be together all day long. There's going to be no in-person before school and after school, again, to maintain that cohorting. They will have recess, but they'll have recess in their cohorts. Students' personal belongings, we're going to ask, probably insist that most of those belongings stay at home. I know sometimes kids like to bring into school things they want to share, cool toys, books they're reading, art they've done. We're going to ask that those remain at home. We're going to provide all the academic supplies in person. Again, it's to maintain and to decrease risk. Meals will be staggered and they'll be served in the classroom. So we're also going to ask no food from home. So if you have special dietary accommodations, we'll ask you about that and we'll make sure we meet them. Other logistics and safety concerns, cleaning, disinfecting. This place is going to be clean. It's really clean right now. It's going to be even cleaner. We're going to disinfect throughout the day, all high contact surfaces, doorknobs, desktops, books, laptops, all those things. Every teacher is going to have things to wipe things down. The cleaning crew is going to be going through wiping things down to minimize the spread of germs. Disinfect daily. So in the evenings, every classroom, including all the ECE, early childhood education cots, are all going to be disinfected. So every night, everything will get disinfected. And then we're going to disinfect the whole entire building with electrostatic spraying weekly. That's the best and highest form of disinfectant we can do. It's better than what they do at a lot of hospitals. So we're going to do it every week. And we've done it before, and it really, I think, does minimize the amount of germs in the building. If anybody's diagnosed with COVID-19 in the community, there's very clear protocols, thanks to the Office of the State Superintendent for Education and DC Department of Health and the CDC, what to do. The staff is going to be trained on that. We are going to follow it to the letter. And we've got it all broken down in nice, understandable formats too for our staff, which we have shared with them before, and we will make sure we train everybody on it. Air filtration is something a lot of people talk about, so I want to talk briefly about it. Again, if you were following this process back in the fall, we mentioned that we had contracted with a group called SETI. SETI are the national leaders in air filtration for academic buildings. They're who DCPS went to, colleges go to them, all of that. They have looked at our building, they've analyzed it, they've given us short-term recommendations and long-term recommendations. Short-term recommendations we've already put in place. A HEPA ultraviolet C filter is in each classroom and in each office. What that means is we filter the air 6 times every hour. And when I say filter, it's not just taking out the dust, it's blasting it with ultraviolet light that kills 99% of the germs. And that's going to happen 6 times per hour. We have some classrooms where we can open windows because obviously fresh air is always a good thing, but we can't do that for every window right now. In the new part of the building, we've already got the highest asbestos, that's a terrible word, I apologize, but we've already got all this built into the building and the new part of the building into that air mover and that air system in the part we just renovated, the 6,000 feet we just took over. We're getting bids and pricing for what it would take to do the rest of the building. It will be an incredibly expensive project and take months to accomplish, but we're going to figure out what it takes and put it into place as soon as we can. Now, again, because I try to be transparent and as honest as possible with everybody, we're going to keep, these are some things we all need to keep in mind as we move towards this in-person platform. It is targeted to begin in April. We may not have a spot for every family member or every student who wants one. That's just a sad reality because everybody has different interest levels of coming back to the building. So if we have enough staff, we may have a lot of staff and not enough students, or we may have a lot of students and not enough staff. It's going to be a balancing act. We will keep you informed as we get those numbers and as we know how many seats open up. I do honestly believe as we get going, people's confidence level, meaning the staff's confidence level, is going to grow. They're going to see it's working and more of them are going to be willing to come back. But that is something, again, we've got to try it out. We've got to make sure it works to build that confidence. So we may be forced to offer spots via lottery. We may have preferences given to priority populations. As I mentioned, we've done a deep dive into our data. So as an example group, not the only group that's getting priority, but as an example, English language learners are having a difficult time accessing, some are having a difficult time accessing virtual learning due to language barriers. So that might be a group that gets additional priority versus a native English speaker. So those are all the kind of things we talk about hours on end and analyze as we're thinking about who to bring back into the building and how to prioritize our lottery. Some classes and grades may have teachers who are only able to work remotely. We have some staff who may be immunocompromised, who may have family members where they're taking care of elderly family members, or they have young children and they're not prepared to come back into the building. They don't feel it's safe. So they may continue teaching remotely. So as an example, it could mean the random second grade class. And this isn't to say our second grade teachers have said this. I just picked second grade because it was the first one that popped into my head. They may opt to teach from home. So the second graders who come into the building may not have their teacher in the classroom with them. They will still be learning from that teacher because they'll be learning the virtual lessons that their teacher's been teaching them. But it may be supported by another educator in the building. And it is possible that entire classes may have to stay remote. Again, we've talked about that, but again, I feel like I have to reinforce this so we are honest about the potential challenges. I do have good news, and I want to end this deck on good news. We're actually really excited about this program. And I have to say, I got to give credit to our student government and to our parent community for really coming up with this idea and pushing it and getting our aftercare folks to really think about creating some new clubs. We heard from our students and from our families that our kids want to socialize. They want to see their peers, even if it has to be virtually, in something other than class, in a situation other than learning their fractions or learning about history or whatever the case may be. So we've been spending the past few weeks, month almost, figuring out some things that we can offer. So we're going to be calling it the Remote Extended Creative Day. So it's like an after-school program, but it's going to be remote. And again, this is to have fun, to do some organized activities with their peers. We're currently going to be offering 30-minute sessions on Mondays, Tuesdays, and Thursdays. Again, no Wednesdays because it's PD day, and Friday because quite frankly, we don't expect a lot of families to participate on Friday, but again, we'll let demand drive that. The sessions are going to be limited in size, so the kids will have a chance to interact of up to 20 students. And the goal is going to be to change activities every 30 to 45 days so students can engage in a variety of programs. So, and we'll talk a little bit about what some of the initial offerings are likely to be. So we're thinking about doing some additional art offerings, fitness offerings, Spanish language offerings, cooking, facilitate peer circles. So sort of a chance for peers to talk about what it means to be in the pandemic and talk about the middle school gossip that we all love to talk about back in middle school and to have that social conversation. But it'll be facilitated by someone from the school. The activity cohorts, as we're currently thinking as a way to group them, is early childhood, given sort of their ability to access and the kind of activities they enjoy. Grades 1 through 4 being cohorted together, and grades 5 through 8 being cohorted together. And again, demand's going to drive this, staff availability is going to drive it, but there's been a really positive response both on the staff level and from our student government when we talked about this as a possible option. And with that, that is the end of the formal presentation. So I can't see what's going on in the chat. I can only imagine there's dozens of questions. So I'm going to stop sharing my screen and I'm going to let Craig sort of take over and start directing the questions to the appropriate people to answer. And thank you for your attention. I'm sorry I talked so much, but I wanted to get this information to you.
All right, thanks, Chuck. Yes, I've been busily taking notes and trying to group questions. We have groups of questions kind of around the model, around the approach, some around logistics. So I'm going to try to knock out a couple of the low-hanging fruit, easy ones quickly. About the building being opening for all staff next week. Yes, all staff were invited to come back into the building. We wanted to see what demand would be, and then if we would need to throttle kind of how many days folks are in the building or if they need to come into groups. Right now we're to find capacity. So all staff members were invited to come back. Then another one was, how often is the COVID testing happening? Right now the program is running monthly. We're probably going to bump that up until it's 2 times a month coming here in March, and then potentially even more frequently after that. We're going to kind of gauge what the demand is, how it goes, and then as Chuck mentioned, we'd like to open it up to all the students and families that are coming back, and possibly even eventually, even if you're virtual, open it up to our whole community to try to take care of the whole community. So those were a couple of the quick ones. Heather, I'm going to ask you to unmute and very quickly give the high level of what is the process if there is a positive case in the building.
Sure. So if there's a positive case in the building, it depends on when it is noticed. If the people in person learning, you have the option as a parent to sign to have your child, if they get sick during the school, to be COVID tested by the school nurse as part of the Children's National and DC Health screening. If somebody consents to do that and the child tests positive by the rapid test, then the entire cohort would be sent home and everyone would have to quarantine as per the DC health guidelines, which we will share in a document. There's just a lot to talk about in a short meeting. In addition, the entire building would be cleaned with the electrostatic splaying and disinfected, and then people would be able to come back in. It's detailed in our recovery and reopening document, which is located on the website, but I do apologize. The document is 100 pages, but we have been working to condense them down and working on like slides with some highlights of information.
Okay, thank you, Heather, very much. And I'm sorry, I was trying to skim questions while you were talking. There's also, we can post or put out there, there's the flow chart that is determined by DC Department of Health and OSSI that lays out very clearly what the protocols are for cases that folks would be welcome to look at. There was a question around the vaccine only being available for those currently in the building and how that process is working. Yes, the first round of vaccines for educators in the district were intended for folks currently supporting in-person learning or in-person services for kids that are coming into the building. And we did submit a group of folks to do that. To be honest, we probably could have tried to skirt the system and submit everyone, but we did not think that was the right thing to do since there's such high demand for the vaccine. We wanted to be thoughtful and respectful of the process out there. We are awaiting guidance, and there's lots of lobbying going on behind the scenes, trying to drive more vaccines or more vaccine doses to be available for educators. But as of right now, we do not have guidance from the city or Department of Health and when that next batch may be. But as I said, there's lots of people banging quite loudly for that to happen, Chuck being one of them that is lobbying as hard as he can behind the scenes to try to make that happen. We had a question, I want to loop back as far as why we're not requiring tests and will kids be sent home. Chuck, if you want to kind of jump in on that one. Well, one of the reasons I'll start off with is the CDC, I don't believe still has not recommended that everyone be tested before coming in, citing that the usefulness of that is really unknown at this point, as far as how effective it really would be, given that a test is a point in time. It is helpful, but as far as ensuring folks coming into the building are negative, you'd have to test them every day to make sure that's the case. But Chuck, if you want to chime in with more, please.
Yeah, well, you pretty much nailed it, Craig. That is something that's come up a lot in the talking with the mayor's office and deputy mayor and the health officials. Is it ever going to be required, like a TB test, for example, or getting a measles vaccination or any of that kind of stuff? And this applies also to vaccinations. Currently, they're not prepared to make that a requirement. The vaccine, just to talk about the vaccinations first, because I expect that question usually tails on right after the one about the test, is still only for emergency approval. It's not for wide approval yet. They're moving towards that. So that's why there aren't a lot of doses available. That's why the city is still controlling who gets it and who doesn't get it. And that's why the feds are still controlling who gets it and who doesn't get it. Biden's administration was just able to get another 2 million doses committed to, but the delivery date is probably summer-ish for those other 200 million doses. And that will only increase the current availability by 50%. So it's going to be a while before we have enough for everybody where we can make it a requirement. Also, there's some federal medical privacy issues wrapped up in it that they just haven't gotten their lawyers' eyes wrapped around yet. So they haven't been able to give schools good guidance on whether you can require it, whether you cannot require it. So that's sort of what's going on with negative testing requirements as well as requiring vaccinations. But we are lobbying hard. We are encouraging our staff to do both. And we're trying to make it as easy as possible. And Craig isn't joking when he says we are pounding the tables on a regular basis to get more vaccinations and more testing available, and to encourage people to do it. So there's that. And I think, did I answer the whole question?
I think you covered it pretty well, Chuck. We do have a lot more, so I'd suggest we just keep kind of moving through them. If folks feel their question wasn't answered, well, they can resubmit and we'll try to pick back up on those. I want to go over to NIAMCA now. There are a few questions that I captured early on around the model. And one of those, NIAMCA, was, can a student follow the hybrid model when they're in person some days and home from some? And I think this is getting at to kind of what this schedule would be and allowing kids to ease into it on the 2-day, 3-day off schedule or along those lines, if you want to expand on that a little.
Sure, I can tell you what we know so far. So what that looks like is if potentially we want our lead teachers who really know the content and curriculum really well to continue to be able to deliver that instruction so that students are really having the full breadth of what the various standards are. And what that looks like, it could be if a student is in person, they could and their teachers in person, they might be receiving that instruction in person there. However, on different days where they are not in the building, they could be potentially receiving that instruction through the virtual platform.
Okay, great, thanks. There was kind of a question around the teacher's responsibility. So if a teacher is responsible for both, or will they be responsible for both virtual at the same time, or do two sets of kids, kind of how that coverage would work?
Sure. So we want to be very mindful of, we don't want a teacher have to teach virtual lessons all day or teach the in-person students and then have to teach the virtual lessons online. We want to be mindful of, dividing that up and trying to keep it as consistent as possible. So for example, if a teacher, one of our lead teachers decides to come in person, we would want to keep their, just for example, if we had our early childhood teacher come in, they would keep their morning meeting time with their class consistent and their small groups. During those other times, the additional adult who's in the class would be supporting the students in that CARES classroom, so that we're really trying to minimize any sort of disruptions to the schedules that seem to be working really well for most of our families. We're trying to just add a layer of support so that those students who are not able to have someone at home support them getting onto their devices and to finding their materials. We're hoping that by bringing students in, we can offer that support for students so they still have access to those rich lessons that teachers are able to deliver.
Okay, great. Thanks, Nyamka, very much. Another kind of question around the schedule. One specific situation was, if my student finishes early in the afternoon and they're in the building, what are they doing for the rest of the day if their current schedule, like I said, it kind of finishes them earlier in the afternoon?
Sure. So the way the schedule is set right now, we would keep that. For example, if you notice in some of the times a class ends at a certain time and in their next virtual lesson, there's a time in between. So that might be a time where they're having recess. That might be also a time where they're in their small cohort. There might be a read aloud, or there might be additional opportunity to do ST math or read a book on epic. So we built those additional times in so that they won't just be sitting there. They will have opportunities to do other things, but they will still remain, have the ability to access their schedule that they had before. Just kind of adding additional things in that we can offer in person. Students at home could do those things too, but we would just have them do them at school.
Great, thanks. And then maybe recap a little bit if you haven't, and if you did just answer this, I'm sorry, as I'm also kind of skimming questions. Unlike usually paying close attention to you, will kids who return to the building be taught in person or virtual classes, and kind of what are those kids that are in the classroom kind of in that March timeframe getting from the folks that are in the room?
Sure. So the students who we've identified who are having those challenges with the current in distance learning at home, a lot of them may not have the support from an adult to have them log on to Zoom. They may not have someone there who understands what the math lesson is and can kind of offer them some additional support after the lesson is over. That is also the person who is providing that recess coverage, supporting the students, ensuring they go to the bathroom, wash their hands, and are coming right back to the classroom. They're also facilitating some of those read alouds and ensuring that students are staying socially distant. So those are some of the things that are happening when they're in person.
Okay, and then there's a couple questions around the challenging situation around making a decision as families, not quite knowing if my child will have the existing teacher or a different teacher. And there are a lot of that's a complex question with lots of implications, and one that's on, it seems like, several folks' minds. So if I can keep you on the hot seat and answering that one.
Sure. So when we developed this distance learning plan, we were really thoughtful about having students in, especially in lower school, really have access to all the teachers so that they have a relationship with all the teachers at that grade level, because we weren't sure who was going to come back in, what that was going to look like. So the great thing is that all the teachers, for example, in early childhood, they've had experience with all of those teachers. So if there's a teacher that came back into the building, it's a familiar face. It's someone who they've seen before and will be able to, continue to develop that relationship. So that was our hope with, having the students have access to all of the teachers in those grade levels. Is that?
I'll ask folks if they still need clarification or want to revisit that, if there's time to repost that in the chat, as we are trying to cover as many of the questions as we can here. A couple questions on approach and what grades are being invited back for April 1. We may have touched on that, but it is we are surveying all families to see which grades we can accommodate. And it would be hopefully with the ideal plan of accommodating all grades. Nyamka, anything else to add on that?
No, yes. And what we're hoping is, like I said, to offer more opportunities for any student. I think this first round is really targeting those students who are having the challenges, but we really would like to open up to the broader community, anyone who is interested in participating, that it's going to be open to anyone who's interested. And maybe it's better if we maybe say form versus a survey, because we want to hear from families, like, what are you thinking? And during that time, we're going to be asking you to make a decision, because that's going to help us develop what the plan looks like. And another question I saw, and I just wanted to hit this real quick, is a question about why we're waiting on the survey, because we wanted to be able to provide families with as close to what it could look like as possible, so you can make an informed decision. And our hope is that by having us, during this time, really start to parse through and have some students in the building and see what it looks like, we'll really be able to structure and identify exactly what that looks like, so you can make an informed decision.
Okay, and you touched on one of the questions that I was about to throw your way, around what criteria were used, or kind of how did we determine that first batch of students?
Sure. A couple of things we noticed, like attendance data. If a student was not showing up, having over 40 absences, that was something that was really alarming to us, even after constant calls and things like that. If a student is not showing up, we are concerned about their well-being. Also, students who were having difficulties, like challenges with their internet, and they would try to log on and would be kicked out. Or students with some of the assessment data that the teachers were collecting was showing that the student wasn't making any progress. Or just the teachers were super helpful in, giving insight onto just noticing that either that they knew the child from before, and just their complete approach to learning had changed, and they noticed those things. So there was a lot of things that we understand that distance learning has been something that we've all had to adopt and kind of adopt to. But there's some students who are really struggling, and we really wanted to do our best to start to bring them back. So those are kind of the things that we kind of prioritize as we identify these first set of students.
Thanks, Nyamka. A couple questions around what's the summer plan, as well as if we've given any thought to what next year looks like. And Chuck loves his crystal ball that is sometimes quite cloudy. So I will hand it to him to share what he's seeing.
So it really is sort of it is looking into a crystal ball, or I'm sure Vegas is betting on it as well, just like sports. Will we be back in person in the fall? I'm cautiously optimistic that we will be. We're going to build our budget and our staffing model this spring around being in person in the fall. Current thinking from the federal experts and all the people we're trusting, for scientists, saying they believe we'll get to close to 70% vaccinations late summer, early fall. I think we will have exercised our in-person muscles enough to feel strong enough to bring kids back as well. And we'll have a much better sense of the impact of the variants over the spring and the summer. So we are planning for in the fall to get back to whatever normal used to be and bring the kids back. We are dying to get back.
Great, thanks, Chuck. I'm gonna try and knock out a
Summer,
couple.
sorry, I didn't address summer, sorry.
Oh, sure.
Because it is a hot topic right now. A lot of people are talking about it. No one meaning, no one of the educational leaders in the city are saying, yes, you have to tutor over the summer. Yes, you need to extend the school year. Part of that is every school is still trying to figure out the impact of the pandemic and virtual learning on students, and what that's meant for their academic progress and their socio-emotional well-being. So that's why we're trying to get kids back so we can start to get to know them better and collect that data and figure out where we need to backfill, where kids have done fine. Maybe virtual has been great for some families and they want to stay virtual forever, who knows? But we won't know that until we start getting them back here and really understanding where people stand. So there isn't a hard line on what summer is going to look like. Also, you have to remember it's a staffing question. 10-month teachers, summer is not the same for them. It's not part of their contractual work. So we would have to figure out how to accommodate that. But if we do make the decision to do it, we'll figure it out. But right now, that's sort of the best thinking that's out there.
Okay, thanks, Chuck. I'm going to move on to knock out some of the logistical questions that had been posed around how are bathrooms being handled. Every other stall and every other sink will be blocked off. Bathrooms will be cleaned frequently throughout the day by our cleaning crew. Cohorts will have assigned times to use the bathroom so that there's not a lot of overlap. Certainly, if there's an emergency, we will let the student go to the bathroom, but it'll be very controlled in terms of when folks are going in, coming out, and the cleaning that happens in between that. There was a question around eating indoors versus outdoors. Certainly, we will try our best to eat outdoors and do as many things outdoors as we can. I know Nyamka and her team have been spending a lot of time thinking through what the opportunities are to provide outdoor instruction, how that would look, how that would work. And eating indoors, unfortunately, is the reality of the situation in that folks, to minimize movement throughout the building and commingling, they will eat in their room. As we mentioned earlier, there are the air sanitizers in the room. There are defined protocols by DC Department of Health for what that is to look like. That's what I believe all schools, the model they're following is eating in the classroom or in one spot to minimize movement throughout the building. Another question, we talked about the plan for next year. Chuck, there was one question around staff and staff coming back and if there's some hesitancy there. So I'd like to pitch that one over to you to kind of address where we sit with staff.
Sure. So the short answer is yes, there's hesitancy in coming back. I think the same way people are hesitant to go back into their offices, the same way people are hesitant to go to grocery stores, to go to parks, playgrounds, museums are closed. So there is hesitancy. So that's why we're trying to build confidence. That's why we're trying to train. That's why we're trying to create protocols that are easily enforceable and effective. We've surveyed all the staff. We know we can handle the phase one, the March number of kids who want to come back. We can handle that up to 50 number of kids with the number of staff that are willing to come back. There are a lot of staff who said they're willing to come back after they get vaccinated. So this is why I'm pounding on doors to try to get more people vaccinated. It's sort of a cart before the horse. I really honestly believe the mayor in the city made a mistake by saying you can only get vaccinated if you're providing in-person services now. I understand they're worried about the supply and all that, but the impact it's having on school leaders and schools in general is, and you see this at DCPS, you see this with the shenanigans that's going on with all the unions around the country, in particular the Washington Teachers Union has just filed a lawsuit against DCPS. You see that folks aren't quite ready yet to come back and don't feel completely safe. So we're going to do everything we can to make them feel safe. We're going to teach them how to be safe in the building and how to keep the kids as safe as possible in the building. And we're going to build that confidence. We're not going to be able to flip a switch. There is no miracle cure. I'm sorry, that was really bad information that was given last spring. The vaccine is not a miracle. The vaccine reduces the impact if you catch the virus. you can still spread the virus even after having the vaccine. So folks are advising us that we're going to have to live with this for a while. And we're just going to have to accommodate this pandemic, this disease for a while, this illness, and do the best we can in those circumstances. So I think that answers the question. I hope. If not, please, I'm happy to continue discussing it.
Great, thanks, Chuck. I'm going to loop back to one of the logistical questions that I neglected and ask Heather to take it around. What does pick up and drop off look like, and the concerns around safety there? So Heather, this is a topic you are well versed in.
Yes, so we're starting about the coming into the building. One of the first things we are going to ask every staff member and family to do is sign an in-person code of conduct, which basically says that I will adhere to all the health and safety guidelines. For any student or staff can come in the building, they actually have to complete a health screener, like a daily screener that'll ask about COVID questions. For students to come into the building, the health screener, you either have two options. You can either download an app on your phone and fill it out. And when you are done with the app will either flash red or green on the back screen. So you can easily tell if you passed or not, and it'll tell you if you can come in or stay home. That needs to be filled out each day when you come in the building, and the app is set so it does not collect any of your personal information. It doesn't store everything. Everything is on your phone. The school doesn't actually get it, and it has the date on it. That's why you can't fill out the app on the first day and then never do it again. It actually has something in there. Once you decide to come in, the students will come through the Harewood gate. And if you are doing, that's for carpool. If you're doing carpool, you'll pull up kind of like you did pre-COVID, except for when we open the door, we're going to verify that you've passed the health screening. And if you don't do the screening ahead of time, we'll ask the series of questions that are on the screener. They're basically the standard COVID questions. And then the parents will stay in the car. The children will go into the building. Because we have our new area in Sherman South, students can actually enter through the traditional Sherman North ground floor or the South floor, and then they will go in the building straight up to their classroom. For people who are on foot or taking the metro or walking, they will enter through the Eagle Gate, and there will be a screener set up right there, kind of where the ground floor playground, where the ECE goes out to recess, closer to the Eagle Gate side. Again, same thing, you'll ask a series of questions. If you answer them satisfactorily and you pass the screening, you are allowed to come in the building. If for any reason you don't answer the question satisfactorily, you'll be sent home. If for some reason a child takes the bus by themselves, then we will put the child in the isolation room, which is something we haven't covered here, and they will wait there until an emergency contact or their parent picks them up. We will call you and ask you to come get your child. So that's kind of a general overview of how it will work.
Okay, thanks, Heather. And I wanted to loop back to one more around why we're not taking temperatures upon folks entering the building.
A couple of reasons. The first reason is that taking temperatures isn't necessarily the most effective screener for COVID-19. The second reason, DC Health does not recommend taking temperatures. Third reason is in order to take a temperature, all the PPE requirements, it's very long. The fourth reason is if we take the temperature of every person walking in the door, not only is it not necessarily the most effective way, it is very, very time consuming. And so for school to start at 9 o'clock, if we had 100 kids, we would have to have the first group of cohorts show up at like 6:55 in the morning in order to screen everyone in.
Okay, great, thanks for that. And I want to loop back, there's been lots of kind of questions and some back and forth on vaccinations and the process for that. We had the opportunity several weeks ago we had about an hour, a few hours notice to submit an initial list of staff that were participating in person, either via services or learning or in some capacity working out of the building, to the DC Charter Alliance in order to get those folks prioritized for vaccinations. That was very clearly defined as folks that are currently providing the services or support or working in the building. There has not been an opportunity. We are not able to submit names. Believe me, if we were, we would have sent that list in seconds after it was said that we can submit additional names. The only folks that are being vaccinated right now are folks that were on the initial submission list that charters and schools put forward several weeks ago. DC Health does not know or can't say right now how much of a backlog there is. Yes, that is absolutely correct. It may take a while. The frustrations are shared across all of the charter schools. We were on a DME call earlier this week where that topic came up, and we were certainly advocating for the need for clarity and what a blockade that is to really being able to scale operations and getting more staff vaccinated. But where the situation sits right now is the only folks being vaccinated are what was submitted on the initial list that school submitted several weeks ago. And we are hoping for another opportunity to do that soon and get those folks vaccinated. Chuck, I don't know if you have
I just
anything
follow
to.
up on that point
Yeah,
real
please,
quick,
go
and then
ahead.
I want to make one clarifying comment too. DCPS, the teachers, all the teachers were offered to get the vaccine. They weren't forced to get it, they were offered to get it. That was not the case for charter schools. Charter schools had to present qualified lists of only the schools that had in person. So there's a little bit of a discrepancy in availability and access. So that's one of the reasons why we're frustrated and we're pushing very hard on it. And then I want to apologize. Someone misinterpreted my use of the word shenanigans. I wasn't referring to the teachers or the union, so we're crystal clear. I wasn't referring to people representing their right to be safe. I was talking about how some school systems are trying to force teachers to come back or force them to take leave. That's not something, I promise that to our staff. That's not how we treat our people here. So that was the shenanigans I was referring to, Jennifer. I'm sorry if you didn't catch the meaning of what I was saying, but that was absolutely what I meant. Hopefully you all know me well enough to know some of my views about the system and how one of the reasons I love Creative Minds is how we treat our staff better than a lot in our community and our students a lot better than other parts of the system might. So I just had to clarify that. So didn't want that floating out there for too long. And I thought, Craig, I saw a question that's sort of not directly related to bringing kids back, but if you don't mind, I'm going to jump in because I'm tracking the chat a little bit.
Go ahead.
Someone asked about the playground. So access to the campus is controlled by AFRH, the Armed Forces Retirement Home, right? They are very cautious and careful about who they're allowing back in. You can come to the school if the school's open or if you have an appointment at the school. You can only go to Lincoln's Cottage if you have a pre-existing tour planned. So we will continue to talk to them to figure out what it could look like to open the campus up. But right now, creating a sign-up list or something like that's not really in our control. And our focus is really on trying to get students back in the building. One other complicating factor we're concerned about is once we do have kids back in the building and they're using the playground for recess, having folks who aren't back in the building, not part of those cohorts, on the playground at the same time as them could present some issues. So the only way I currently can imagine it working, again, if AFRH is on board, is kind of after hours is the only, and weekends. But again, that's up to them. It's not necessarily in our ballpark. I know it wasn't about when we're bringing students back and what the academic program is like, but I did see it earlier on. And I just wanted to make sure we hit it.
Thanks, Chuck, for picking that one up. Now I'm going to come back to you with a couple more requests for clarification on some of the approaches. Are we only considering A/B schedules, or what are we thinking about in terms of options for what April may look like?
I think for now, that's the one that seems to make more sense. I know a couple of other schools have do like 1 week off, 1 week on, and that, you know, from initial surveys that we've seen, that was not a very popular choice. They want 2 days a week, AB, or Monday, Tuesday, Thursday, Friday. That kind of seemed to be the more popular choice. And so we thought that would be one that we could potentially offer.
Okay. And if a student stays virtual, will their schedule change or will it remain the same?
We're hoping, like, definitely for March, it will remain the same. April, it's going to be, like I said, it's going to be contingent. We want to try to keep it as consistent as possible because a lot of our students it's working for them and we don't want to disrupt that. But if there's ways that we can add to, you know, students who aren't experiencing challenges, we want to do that. But we really want to minimize any sort of drastic changes to the schedule.
Okay. And then if you can go over again quickly, kind of clarifying what the possible difference may or may not be between what folks in the building in March look like versus students that may be in the building in April.
Sure, I can clarify. It may seem vague because it really is going to be contingent upon how many students want to come back and how many families want to come back. So I don't mean to just keep saying that, but it really is. We want to continue for our teachers, our students to receive the instruction from their lead teachers, because those are the teachers who know the content really well and are able to deliver it. And we want to ensure that that continues to happen. So I don't know if I can provide any more clarity. I'm sorry.
That's fine. Thanks for that. Maybe if you want to touch on, or if Amita's on, I think she is, but what IEP service delivery will look like for students that are in the building. Will providers be able to push into classrooms or do pull out, or how will they receive IEP services?
There.
She's raised her hand. You're going to have to unmute her.
Carlos, or can someone assist with unmuting Amita?
Can you all hear me?
Yep, you're good.
Okay, great. So we plan to follow the city's health guidance, which is recommending a limited amount of cross cohort movement. So right now, our plan is to continue providing related services and special education services remotely per the student's current schedule, with as little change as possible for right now, but that is to be reviewed based upon any updated health guidance that DC puts out.
Great, thanks, Amita, for that,
Sure.
that additional context. A question on surveys, and will surveys be by family or by student? The return survey.
It can be by student, because I think it's going to be dependent on how your child is doing with distance learning and what works best for your family. Some families may choose it's just easier for everyone to come. For some other families, it may be different. You may want your older student to come and your younger one not, or vice versa. It's going to be up to families to decide.
Great, thanks. And just doing a quick time check, we're at 7:40, I think, which is a little over. I think we had this scheduled for an hour, but it's been good conversation. So at this point, well, I'll loop back to a question or two, but also want to kind of tell folks last call. So if you feel your question hasn't been answered, or you have a follow-up, please try to get that in the chat in the next few minutes so that we can try to quickly address them before it gets too late into the evening for everyone. Looping back to one of the questions that I think was addressed, but I don't recall, what will we do if more students want to come back than staff? And as Nyamka just alluded to, it's a tricky balancing act that we're trying to sort out here between staff capability and availability to come back, and how much demand we have for students wanting to come back into the building. So it'll be a situation that once we're able to kind of see the data, we'll be able to come back to everyone with more details on what we're able to support and what that looks like. And as I skim some more questions, Chuck, Nyamka, anything you want to add or chime into on that?
Yeah, I just, like you nailed it. I just wanted to address a couple of other questions I saw about the outside. Yes, we absolutely want to have students outside as much as possible, and with the eating, like, so on days that it's, not pouring down or you're not freezing cold, we do want to take students outside, and we're setting up picnic tables outside for students to eat outside. So yes, that is something that we are definitely want to encourage, while students have masks off, for them to be outside for those times. I saw another question about information on preschool, pre-K. Is that about bringing students back? When we, ask if families want to bring students back, that's for preschool all the way through 8th grade. We don't have any kind of narrowed down factors that we're considering. We just want to know from you if you're interested in having your child return.
Okay, I'm cleaning up one or two more questions here. Heather, if you don't mind, there was a question about how and when we would actually test students on site.
Great. So we actually have two separate programs. This may not have been clear to begin with. Our Sentinel surveillance program is for testing people who are not exhibiting COVID symptoms at this point, and that is done right now once a month, and we are working to set up and do it twice a month. That one, parents have to consent and then just basically opt in for the test. On the test date, you bring your child. The test literally takes about 2 minutes, and as Chuck mentioned, we have a process very smooth. It's done at the school. It's a PCR nasal test. And we know we've been testing about 50 people in about 30 to 40 minutes. The other set of testing that somebody referred to at DCPS that's run by the school nursing program that will do it is if your child passes the screener and seems to be doing well, but during the school day starts showing COVID symptoms. If they exhibit 2 or more COVID symptoms and you as the parent have signed the consent form, then the school nurse will actually do the COVID testing for you. The first test that they'll do is the 15-minute rapid test. If that tests positive, your child will be assumed to have COVID, and the mitigation protocols and everything will go into effect from there. If that becomes negative, then the school nurse may perform a second test, which is the PCR test. The results for the PCR test take somewhere between 24 and 48 hours to come back. At that point in time, the school nurse would take the test. Regardless of the test results, if your child is sent to the isolation suite for exhibiting COVID symptoms, you as the parent will be called or an emergency contact to please come pick up your child. While you're waiting, the COVID test, if you end up doing the PCR test, you would need to self-isolate until the test results came back. If the test results came back negative, you are cleared to go and resume your normal activities and come back in the building. If you test positive, then at that point, we would implement our positive case of COVID-19 protocols. Does that answer the question very clearly? I know initially you caught me off guard and my response seemed very garbled.
I think that was great, Heather. I'll ask if they have a follow-up on it. Just please post it in the chat. We'll stick with you, and if you can expand a little more on the code of conduct and kind of what types of things we're talking about that will be in that document.
So the in-person COVID conduct is literally for the in-person activities. It basically says, as a parent, you will make sure that your child is immunization compliant with the standard DC laws. Immunization compliance is not a COVID immunization because at this point in time, there is no approved vaccine for children with COVID-19. It's the standard measles, mumps, those type of things. Other things, it says that if your child becomes sick during school, that you will come pick them up within 30 minutes. It says things like you will adhere to our policies regarding visiting the classrooms while we are still in the new normal as we start to reopen. It says things like you will do the daily screener every day, your child will wear a mask, that you'll follow basically the rules that we have in place for the school to be safe. And we're also asking all the staff that's in person to sign it as well. Hopefully that answers your questions. It's not going to monitor and make you limit so you can only go to one grocery store once a month. No, nothing like that.
Great, thank you, Heather. I am out of questions, so I'll put one more very quick last call out there to see if we can answer one or two more quick questions if they are out there. So if you can please throw that in there. Hopefully we have addressed everyone's questions. I think it was a pretty comprehensive set of questions. Thank you for those, covering lots of great topics as I practice my stalling skills to see if any additional questions come in.
I just want to give like a huge shout out to Abby and Lorna, who have been working so hard to help put this plan together. And, you know, although they're very quiet on this call right now, they've been doing a tremendous amount of work behind the scenes that just like so happy to have them on the team and just like really appreciate all the hard work that they have done.
Great, thanks, Nyamka. Chuck, I'll throw it over to you to address if we're still having spring break.
Yes. We are going to have spring break. We don't intend to change the spring break timing or calendar. Part of it is exactly what Nyamka was just thanking Abby and Lorna for. Our entire staff are working very, very hard under very difficult circumstances. Many of them are not only teaching, but they're at home as well with their own kids. So they're also having to support their own children. So having a week off is something that we think everybody deserves to decompress. And because some folks may have made some kind of plans, whether it's in the community or our staff, we just wanted to honor that. And also, I think it's a good chance for us to take a break a few weeks in to sort of see how it's going, give the admin team a chance to sort of revisit what's going on and make any adjustments that need to be made. So yep, we're still doing that.
Great, thanks. And before we wrap, to which I'll throw it back to you in just a second, Chuck, I do also want to give the ops team a huge shout out to the folks on the phone, Heather, Carlos, right? All of the support team that's on Heather's team and the others on my team have been working tirelessly to make sure that all the I's are dotted, all the T's are crossed. The team's depth of information or wealth of knowledge and depth of understanding of what the protocols are, what the requirements are, is astounding to me every day. So I just wanted to make sure they're recognized as well, as they're doing an amazing job to get us ready to go with this. So with that, Chuck, Nyamka, back to you.
I'll wrap up. So just again, a big thanks to all of you who are here on the call, for giving us some time tonight, for trusting us with your kids, for believing in us. Craig's right. Everybody in this building and on the staff has worked in the circumstances no one signed up for, and they're trying really, really hard to do it and to do it right and to make sure kids get something substantive out of this. So I'm so honored and privileged to be part of this group and to be leading this group. So I wouldn't want to go through this with anybody else. I don't want to go through it at all, but I wouldn't want to go through it with anybody else. And so I want to take this chance to publicly thank everybody as well. And to also just last and leave on this, across the board, we want the kids back here. That's why we do this work. We miss that joyful noise. We miss the smiles and the high fives and the laughter and the shouting and sometimes the not so happy moments, but it's all just part of why we do this. And so, that's what's driving us, is to do this so we bring folks back safely and as soon as we feel and you all feel it's safe. So thank you again. I appreciate it. If we haven't gotten to your questions today, or you log off and you think of something, shoot us an email. As Jen noted, we're going to put everything on the website. So there is a running record. This has been recorded. So if you know anybody who couldn't see it, tell them Saturday we'll do it again, but also you can always watch the recording later. Okay. Thanks everybody. Have a good night.
Good night, everyone.
Thank you.